Hello everyone, welcome to our channel. In this video, I am going to explain about the sinusitis. Itis means inflammation. Whenever there is an infection or inflammation in the sinus, we call this condition as sinusitis. First, we're gonna see what is sinus and the functions. In every human body, in the head or face, there are 4 pairs of cavities are present which are filled with air. We call them as sinus. This sinus produces a mucus which helps to prevent infection, and also it lightens the skull and protects the brain by providing a cushioning effect. Generally, there are 4 types of sinuses. Maxillary sinus, which is located under the eyes and the cheek. Frontal sinus, which is located above the eyes and behind the forehead. Ethmoid sinus, which is located between the eyes. Sphenoid sinus, which is present behind the nose and below the brain. But in some conditions, this sinus gets infected. This is filled with pus, which causing inflammation called sinusitis. There are many reasons for sinusitis. Commonly, the cold or any flu or influenza virus, allergies, and if there is any problem inside the nose, deviated nasal septum, or if any polyps are present in the nose like nasal polyps, there are chances of getting sinusitis. And in conditions like enlarged adenoids, bacterial, viral, fungal infection, and in some tooth problems also, there are a high chance of getting sinusitis. If a person has sinusitis, they may experience certain symptoms like nasal stuffiness or nasal blockage. There will be runny nose with thickened yellow or green mucus, and post nasal drip is observed. That is, the mucus will drip down to the throat. And other common symptom is, we know that sinus is filled with air, but in sinusitis it is filled with pus. So the person experiences severe facial pressure or heaviness in the face or heaviness in the head, and this pressure will be seen behind the eyes, ear, nose, etc. And these symptoms may also worse when the person moves their head and bend downwards also. Along with these symptoms, there are headache, teeth ache, fever, cough, etc. All these are the symptoms of sinusitis. If you experience these symptoms, please consult the ENT specialist, where doctor clinically examines. By clinical examination symptoms, they'll come to the conclusion. In severe conditions, they may advise nasal endoscopy, CT or MRI scan, allergy testing, etc. Coming to the treatment, in sinusitis, generally doctors advise some nasal decongestants or nasal corticosteroid sprays, saline nasal rinse, etc. If sinusitis is because of the polyps, doctor may advise to go for the surgical removal of nasal polyps, etc. Coming to the home remedies, if a person has sinusitis, they should take ample rest, and they should drink plenty of fluids, water, etc. And warm compression on the nose and forehead. It also reduces the pressure in the sinus, gives the relief. And using a vaporizer, a steam vaporizer also is equally effective in reducing the sinus pain. Coming to the prevention, if a person has sinusitis, he can prevent by following certain precautionary measures, like we should avoid the triggering factors. What triggers the sinusitis? We should avoid the cigarette smoking. Regular use of home humidifiers. Home humidifiers makes the room moist. It prevents the dryness, thereby reduces the sinusitis. And maintaining a proper personal hygiene, like regular hand washing. If other person has cold, we should maintain certain distance so that we can reduces the risk of sickness and reduces the risk of sinusitis. Coming to the complications, if the sinusitis is not treated properly, rarely it may give some complications like abscess, bone infection, brain infection, eye infection, etc. This is all about the sinusitis. Hope you like the video If you like the video, please share and subscribe our channel. Thank you.